COVID death toll in the country approaches 400,000 tonight. There are so many stories of survival thanks to the help of frontline healthcare workers. Monique Jones was hours away from death when doctors made a decision that would save her life and the life of her unborn child. Only News 4's Caroline Hecker spoke with those who took care of her and shows you a bright spot in the middle of a very dark year.
The days are long in the COVID ICU at Barnes Jewish Hospital, often accompanied by stress, anxiety, and downright grief. But ICU nurse Caitlin Obrock keeps pushing forward. It was the middle of one of those long days when she encountered 28-year-old Monique Jones.
I didn't even think I would talk to Monique again. Better yet, develop such a special relationship with her.
Jones was intubated and eventually placed on ECMO, a machine to help her failing heart and lungs. Caitlin says she knew Jones was scared, and that's when she and her fellow nurses started whispering in her ear, small daily messages of encouragement.
If I were that patient in bed and there is a small chance that she could hear me, I would want some reassurance and to hear a voice, to feel someone hold my hand, just to know someone's there, that we're fighting for her, and that she should keep fighting.
More than a dozen doctors met daily, monitoring Monique's progress.
We do not have any data, any previous or reliable information to follow. So that was our big challenge.
Monique's condition was not improving like doctors had hoped. So at 29 weeks, they delivered her baby, Zamira. Immediately, she began improving, coming off ECMO and the ventilator within 10 days.
Patients that are as critically ill as her don't return to the life that they had prior. And Monique is returning to the life that she had prior, which is amazing.
While in rehab, Caitlin threw Monique a surprise baby shower, promising to stay in touch. That's now a reality, as Caitlin is Zamira's new godmother.
I wish you more tippy toes than deep.
The balance of emotional and clinical support for every patient is an important one, often meaning the difference between life and death.
This was special because not only one, we were able to save 2 lives. And this left an indelible mark on the whole team. This has been an unforgettable experience.
I really think she'd be looking at angels.
In St. Louis, Caroline Hecker, News 4.
Jones was able to bring her daughter home from the hospital in mid-December, less than 3 months after she gave birth. Doctors say throughout this pandemic, she is the only pregnant COVID-19 patient to be placed on ECMO in Missouri.